these are things that are important to start thinking about and looking towards if you are interested in being an emergency doctor, because I think it is definitely a very different niche, and you have to have certain qualities to really be successful as an emergency doctor. And so I wanted to share these. These were from Jan, criticalist in California, and I have adapted them, shortened them a little bit to share with you. But I think even as students, one of the most important things to learn is that the real work really isn't the veterinary medicine, it's the people. And in emergency medicine, one of the things you have to learn very early on, which you should start watching people even as a student, how they gain the confidence of not only the clients, but the referring veterinarians and other colleagues around them. And in emergency medicine, you usually have to gain that confidence in the client within a few minutes. And so that's something that is a huge part of medicine, is the client communication and just communication in general. I think one of the scariest parts of being an emergency doctor is your very first weeks on, the expectations that you have of yourself. But it's important to remember that no one pays you to be the best, just to do your best. And that's really all you can ask of yourself. And when these patients come in to the emergency service, the clients are already expecting the worst and are scared. And all you can really do is do your best to get that patient, get the underlying disease figured out, and treat the patient the best you can on those overnight shifts when you're by yourself. The dread of the first emergency shift, even as a student, can have a lot of anxiety and stress. I remember that was one of my favorite things about being a resident and an intern, was having these students come on and within the first day or two, just relaying to them that it's not scary, it's one of the most fun rotations you have, and you really do learn the most on those rotations. So I even encourage you to get out there and do those rotations as your first rotations, especially at Michigan State. It was a great way to become well-rounded very early on and just get over the anxiety and stress. But don't forget the basics. That's one of the places where we really, I think emergency critical care does a great job of teaching the basics of your physical exam, the basics of history, which is huge on the emergency service, and the basics of triage and kind of your ABC. So always go back to those things rather than kind of getting overwhelmed. Again, instill confidence in your client. So learn to say, I don't know, in a way that instills confidence to the client. And that's something that's sometimes very hard to do when you're an emergency doctor. But I think the biggest thing is explain the process to the client, that here's the possibilities of what's going on, here's what we're going to do to figure it out, and then here's the step 2 and step 3 if we need to get to that point. And I think clients respond very well to that, even if you go in not knowing the diagnosis. I think it's, probably 50% or more of the time you don't know the diagnosis going in. Always put out fires before they start. That is not only a huge thing for emergency doctors, but also a good ICU doctor. So we're constantly anticipating the next step and trying to put out those fires again before they kind of get into an out of control situation. So always knowing what to monitor for, when to monitor, and when to step in. And that's something that definitely you learn as you go. So make sure you have a good mentor, no matter what it is, an externship, an internship, your first job, someone that's going to teach you those things. And then the last 5 key points are handling multiple patients simultaneously. This is huge. I think that most of us as veterinarians, when we go into this, we're already very good multitaskers, and I think emergency medicine just takes that to the next level. So you really need to learn to treat patients in parallel, not in a series. So we're usually handling several cases at once, and we have to figure out, which one needs our attention right now and which one can be kind of third and fourth in line. And you definitely, again, you get good at that by watching other people do it. And it just comes with time and experience. Changing the definitions for emergency medicine, I think one of the big things, even as a veterinarian, whether you go into emergency or not, learning to redefine aggressive or intensive care versus proactive and explain that to a client. We're going to do X, YZ because we want to be proactive, not aggressive. I think changing that term when you're approaching clients is a big thing, and learning to communicate even as a student is a really good thing to practice, because I don't think we get a lot of it when we're going through veterinary school. Changing the paradigm, assume they're sick until proven well. Clients are going to bring these cases into you at 2 a.m. on the emergency service because they think there's something wrong with their pet, and they know their pet a lot better than you do. So always remember to pay attention to what the client is telling you, and definitely listen to them, because they may not know what the problem is, and that's where our job comes in, but to not assume that there's nothing wrong with them. One of the things that I learned best as an intern was not to be afraid to hospitalize. Clients don't like to sit and wait for very long. So the physical exam is only one small snapshot in the picture of what's going on with that pet. And so wound care is a good example I put on there, because inevitably it's going to take a few hours for you to address that wound, whether it's a small bite wound or a large bite wound. So I always tell clients, we're going to hospitalize Fluffy for a few hours. I'll call you when the wound is repaired and you can come pick Fluffy up. Goes much better than having the client sit in the exam room for 5 hours or in the waiting room for 5 hours. So that goes for everything: diagnostics, whether or not you need to get a procedure done, radiographs. I always give the client the opportunity to leave the hospital, whether it's to eat something or go home and then come back. And then don't be afraid to hospitalize for observing patients, because if there is something wrong, we may not pick it up on physical exam, but even watching that patient for a few hours may help us. And last but not least, treat the patient, not the numbers. I think as students, especially when I was learning, you get really excited about the numbers, and really you need to keep going back to your patient. And a good emergency doctor and a good ICU doctor are going to go back not just once, but they're going to go back several times to that patient, and trust what your ICU nurses tell you. I think that a key to being a good student and having a great externship year is pay attention to what the nurses are telling you, listen to the nurses, and make them your friend, and they will help you. My nurses are definitely the first people to figure out if there's something going on with the patient, because they notice the subtle things. And so always pay attention to what they're trying to tell you as well.